Hello everyone, thank you so much for joining me today. Today I'm going to talk about a really important topic, infection prevention and control, especially in low resource countries. We are going to focus on the 2010 cholera outbreak in Haiti, one of the most challenging examples of how weak health systems can turn a disaster into a health crisis. I'll explain what went wrong, what worked, and what lessons we can learn. We will look at through two important frameworks, the international health regulations and the One Health approach. So let's get started. Infection prevention and control or IPC is something we often don't think about until it fails. In countries with good health systems, we expect hospitals to have clean water, enough staff, proper waste disposal, and strong hygienic practices. But imagine trying to run a hospital without running water. Imagine not having enough gloves or soap. Imagine a doctor having to reuse the same medical equipment for many patients. In many low resource settings, that's the daily reality. Now add a major earthquake like that one that hit Haiti in 2010, destroying hospitals, contaminating water supplies, and forcing thousands into overcrowded camps. It created the perfect conditions for disease like cholera to spread fast and uncontrollably. So, at the global level, we have rules like the International Health Regulations (IHR) that ask countries to detect and respond quickly to the outbreaks. We also have One Health approach, which says we must think about the human health, animal health, and environmental health together because they are all connected. These ideas are powerful. They tell us how to prepare for health emergencies, but on the ground, especially in poor countries, it's often a very different story. Having a plan doesn't mean much if you don't have clean water, trained staff, or functioning labs. Researchers like Tom Cizike and colleagues in 2021 showed that we still have a long way to go in helping resource countries make IPC real, practical, and sustainable. So the aim of the study is really about learning from reality. We wanted to see how IPC interventions, things like clean water projects, sanitizations improvements, public health education helped or didn't help during the Haiti cholera outbreak. We also wanted to check if the international response matched what the IHR recommends and if the One Health way of thinking was applied. Haiti gives us a clear, painful example of what happens when systems are not too strong to protect people during the crisis. Now let's talk about how I gathered the information for this project. I used secondary research, meaning I looked at information that was already collected and published by reliable sources. This includes reports from big organizations like World Health Organizations and Centers for Disease Control and Prevention, that is CDC. These reports have official updates on how the outbreak spread and how the response was handled. I also looked at scientific articles and real news reports to see different perspectives because sometimes what's happening on the ground can look very different from what's an official documents. To organize everything, I used a tool called After Action Review Framework, or you can say AAR. It's a really smart method that asks four simple but powerful questions. First, what was supposed to happen? Second, what actually happened? Third, why was there a gap between them? And the fourth one is what can we do better next time? It's not about blaming anyone, it's about honest reflection and practical learning. using AAR allowed me to see both strengths and weakness of outbreak response. I also made sure to check whether the response actions matched what the IHR and One Health approach suggest. Sorry. This way, the critique stays focused on real world outcomes, not just theory. So, coming to the challenges Haiti faced during the cholera outbreak were massive. The earthquake destroyed homes, hospitals, water systems, basically the entire infrastructure needed to keep people healthy. People were living in temporary camps, packed closely together without clean toilets or running water. In that environment, cholera, which spreads through contaminated water, found easy victims. Another huge challenge was the slow arrival of international aid. Many organizations tried their best, but coordination was weak at first. Different agencies sometimes duplicated efforts or missed urgent needs. Public health communications was also a big problem. Many Haitians didn't understand cholera. It was new disease for them. Some communities thought it was caused by curses or bad spirits, not bacteria in the water. Without trust and good communication, even the best health advice can be ignored. So, you had a dangerous mix, fragile system, slow response, and confusion among the people who needed help most. So this is just a framework in the slide we can see for the challenges faced. So how we can use the system challenges as people challenges, poor health education, everything is just in the slide. So prevention of infection, access to health services, diagnosis, and the treatment. These are the steps. So in the discussion, reflecting on everything, there are some very clear lessons we must not forget. First, early detection is everything. If Haiti had stronger surveillance systems, the cholera outbreak might have been spotted sooner and more lives could have been saved. Second, while interventions like building sanitization facilities and setting up treatment centers eventually helped, they came late. Early action is critical point. We have to detect early and work quickly. You can't fight an outbreak after it's already out of control. Third, the One Health perspective wasn't fully applied. Contaminated rivers and broken sanitization systems should have been treated as public health emergencies, not just side problems. Finally, the Haiti outbreak shows that having international agreements like the IHR doesn't help unless countries actually have the resources, training, and the system to use them. Plans need to be real, practiced, and resourced, not just words on paper. So, the recommendations for the future outbreak response. So, based on everything we have seen, here are four big recommendations from my side for the future responses. First, we must build early warning systems right down to the village level. Waiting for the hospitals in big cities to notice outbreak is too late. Community health workers need training to spot and report symptoms fast. And the second one is we have to treat clean water, sanitation, and hygiene as top priorities, not nice extras. Safe water and toilets are as important as vaccines during a health emergency. And the third one is we need to better coordination, better different health agencies. Before a crisis happen, we should have already have clear plans about who does what. Not waste time figuring it out while people are dying. And finally, we must work with communities, not just for them. Health messages should be simple, honest, and delivered by the people they trust, like local leaders or respected teachers. Community trust can be the difference between success and the failure in the outbreak response. So, in the results, we can looking at the after action review findings. The results are very clear. Once interventions like clean water projects, sanitation efforts, and community education were properly set up, cholera cases started to drop. The problem wasn't lack of knowledge about what needed to be done. It was the delay in doing it. The real problem was the delay. This teaches us a painful but vital lesson in health emergencies. Speed matters as much as strategy. The speed really matters in these kind of strategies. So, also, another important result was how critical community involvement turned out to be. At first, when messages were unclear or came from outsiders, like the messages was coming from the outsiders, people were confused. People were not able to understand the messages. So people were confused or suspicious about this. So, but once community leaders, the leaders from their community and local health workers explained the things in the similar way, in the familiar way, people change their behavior. People start to using the tricks like boiling water, washing hands, seeking treatment early. Outbreaks are not just about viruses or bacteria, they are about people, trust, and communications. So we need leaders, proper leaders in the community to tell about the outbreaks. So this is the interdependent intervention. There are pillars like pillar 1, pillar 2, pillar 3, and pillar 4. That is prevention, access to essential health services, timely, accurate diagnosis, appropriate quality assured treatment. So one of the biggest lessons from Haiti is that no one intervention works alone. Clean water won't help if people don't know why they need it. Health clinics won't work if people are too scared to visit them. You need education, sanitization, clean water, healthcare, and trust all working together. They all work together. That's why the One Health approach is so important. It makes us think about the whole system, not just one part. So there is one example of interdependent intervention sample. You can see pillar 1, pillar 2, pillar 3, and pillar 4, how it works together. It should be together. Everything works together, like implementation of IPC core components and the education and the behavior change for the health workers and strategic information through the surveillance and research, up-to-date evidence-based treatment guidelines and AMS programs. So in conclusion, the cholera outbreak in Haiti showed both the weaknesses and the possibilities of IPC strategies. When clean water, education, healthcare, and community trust were in all the place, lives were saved. But when the responses were slow or uncoordinated, the consequences were deadly. The IHR and the World Health Frameworks gives us the right ideas, but we must turn ideas into real practice systems on the ground, especially in vulnerable countries. And remember, you must remember in global health, nobody is safe until everybody is safe. Yes, it's true. I repeat again, nobody is safe until everybody is safe. The results reinforce the requirement for developing proactive policies to address global health crisis situations. So here are some references that supported this presentation, all from recent and trusted sources.